All right. Good afternoon and hello to folks and good morning on the West Coast. Welcome to today's event for our NACHC Million Hearts Innovation Awards competition to prevent heart attack and strokes informational webinar sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and events specialist based in the Clinical Affairs Division here at NACHC, and I'm pleased to bring you this event along with my division colleagues, Meg Nieder, Director of Clinical Integration and Education, and Rita Lewis, Deputy Director of Clinical Quality Improvement. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either calling in or using computer audio. All attendee lines have been automatically muted and will be muted for the duration of this event. The duration of this event is approximately 60 minutes, including introductions, presentations, and Q&A. Again, the duration of this event is approximately 60 minutes, including introductions, presentations, and Q&A. During today's event, the chat box will be available at any time. So if you have any sort of questions, comments, or concerns, please use the chat box located in the lower right-hand side of your computer screen. Please select to everyone, type your questions in, and hit submit. It's that simple. Again, the chat box will be available for the duration of this event. Please type your question, make sure you hit to everyone, and then just make sure you hit submit. Again, questions, comments, or concerns will be available for the duration of this event. Friendly reminders that today's event is being recorded and will be made available after the webinar has been completed once we cut the recording and answer all of your questions. The chat box will be available for the duration of this event. Type your comments, questions, or concerns into the chat box at any time during today's event. At this time, I'd like to turn things over to my colleagues who will get our presentation started.
Good afternoon, everyone. Good morning on the West Coast. Thank you so much for joining us, and thank you, Liz, for the great introductions and overview. We look forward to having you all talking with us and sharing your ideas and learning more about our Million Hearts Innovation Competition. So as you'll see with our agenda today, we will be doing a great overview from our CDC colleagues on the Million Hearts 2022 priorities and targets. You can get a great foundation understanding the program and how that leads into the competition and what we're going to be looking for, and also the application and review process so that you have a better understanding and feel confident in being able to submit a successful application. We will be leaving, as Liz mentioned, a good portion of this time for Q&A to really answer your questions and make sure that everyone has the information that they need to submit. As a reminder, the submission deadline will be 11:59 p.m. Eastern Time on Tuesday, November 24th. We will be going over a lot of the details further in the slide presentation. I want to make sure you're very clear on what's going to be to come and what you're going to be hearing from today's presentation. Next slide. And we'll go on and turn it over to our CDC colleagues. You'll be hearing from Judy Hannon, who will be giving you an overview of the Million Hearts 2022 goals.
Thanks, Rita. And good afternoon, everyone. Next slide, please. I am really excited about today's call. I'm even more excited about the opportunity that we've been able to put together with NACHC to offer some funding for innovations in your community related to Million Hearts. I'm going to spend just a few minutes going over Million Hearts 2022 so that everyone is familiar with what types of priorities and projects we might be interested in. As many of you know, there are three priorities to Million Hearts 2022. One is about keeping people healthy. Another one is optimizing care, and that's where the community health centers spend the majority of their time and talent. And another is improving outcomes for priority populations, also an area you all are heavily invested in. Next slide. And we break down those three priorities this way. The keeping people healthy we often refer to as our upstream strategies. So it's about reducing sodium intake, pretty much in the environment. So it has to do with food purchasing policies, et cetera. Decreasing tobacco use, again, in the environment, and increasing physical activity. And on the optimizing care, we have improving aspirin, blood pressure, cholesterol, and smoking cessation services. increasing the use of cardiac rehab, and engaging patients in heart-healthy behavior. I will go over all of these in a little more detail in the upcoming slides as far as what strategies we may be encouraging you to think about, or think about how you would deliver that in your community. And then, of course, we have improving outcomes for priority populations. The populations that we have called out are Blacks, African Americans with hypertension, the 35 to 64-year-olds, people who have had a heart attack or stroke, and people with mental illness or substance use disorders. Next slide. So to go over the keeping people healthy strategies, you can see that we're talking about enhancing consumer options for lower sodium foods and instituting healthy food procurement and nutrition policies. So for you all, I think it might be somewhat of a matter of how integrated you might be to larger systems within your community that may help to be able to reduce sodium intake. In the decreased tobacco use, again, this is the upstream strategy that talks about smoke-free spaces that includes e-cigarettes, pricing approaches, and mass media campaigns. And on the physical activity, we have all of these have a target of 20%. We're looking at strategies that enhance access to places for physical activity, design communities and streets that support physical activity, and developing and promoting peer support programs. Next slide. And then on the optimizing care, the targets are related to aspirin use as appropriate, blood pressure control, cholesterol management, and smoking cessation with a target of 80%. Increasing the use of cardiac rehab, and then engaging patients in heart-healthy behaviors. And the strategies that we talk about related to how do we get there are about using teams, which again you all are very good at, using technology, including decision support and patient portals and default referrals, the different processes like treatment protocols and huddles and all of the things that sort of tighten up our healthcare system, and patient and family supports, whether that's training in home blood pressure monitoring, problem solving and medication adherence, et cetera. Next slide, please. And for the improving outcomes for priority populations, we've targeted a couple of interventions that we think are extremely important for these priority populations because of the data that we see. And we've chosen some strategies that we think will really make a difference. So for Blacks, African Americans with hypertension, of course, the intervention is to improve their hypertension control. And some of the strategies we've leaned in on are things related to targeted protocols, medication adherence strategies, and I think we should be adding there a number of things related to patient supports. The 35 to 64-year-olds, again, is a pretty broad priority population. It is one of our priority populations because of what we were seeing in mortality rates going in the wrong direction and risk factor information going in the wrong direction for those communities. So we've got a couple strategies listed here. And then people who've had a heart attack and stroke are a priority population for which we really want to make sure that for those that have had a heart attack, they are able to participate in cardiac rehab. We know for those that have had a heart attack or a stroke, they need to avoid particulate matter. And we definitely want, and we know this year how important increasing influenza vaccine uptake is. And again, you can see some of the strategies on your right. And for people with mental illness or substance abuse disorders, again, they have a much higher smoking rate. And so we are definitely leaning in on reducing tobacco use. And there's a number of strategies integrating tobacco cessation into behavioral health treatment, tobacco-free mental health and substance use campuses, tailored quit line approaches, and a whole lot more. If you're not very familiar with Million Hearts, I would encourage you to go to millionhearts.hhs.gov. You can see a lot more information about these strategies. You'll also find a number of tools that may be helpful to you as you're thinking about what kind of strategy could you implement. As I just read off a number of these strategies, we do have change packages and other things that might be of extreme value to you as you're thinking about what you could do in your community. And with that, I'll turn it over to Meg and just reiterate that I can't wait to hear some of the ideas that you all are proposing for your community, and look forward to hearing some of the thoughts that you guys have. With that, Meg?
Thank you, Judy. So next slide. So as Judy said, I'm Meg Metter. I'm Director of Clinical Integration and Education with the Clinical Affairs Division at NAC, and I also am the NAC Million Hearts Project Lead. So my role here in today's webinar is really to give you an overview of the competition. Next slide. So you can see that there are 3 goals listed here for our innovation competition, and the first is really the one that involves those who are interested in applying. You here today that are attending the webinar. Our initial goal is to identify and fund at least 2 and possibly more organizations that propose innovations that show promise in positively impacting those cardiovascular outcomes that align with the Million Hearts 2022 goals. And I want to say that you can see up in the right-hand corner, it's an opportunity to win up to $20,000, and that's definitely true, but we want to encourage all size projects. So small amounts of funding, up to 20K is what we're interested in. Obviously we have a budget for this, and the number of projects we fund depends on the proposals we get. So we just don't want people to be sort of tunnel vision into, I have to submit a budget for 20,000 for some project. It can be any range. And then just want to point out the last 2 goals are really kind of our longer term aims with this initiative, which is to expand sort of the current menu of evidence-based activities that we know to prevent heart attacks and strokes. And then of course, if we find some really good ideas, we want to explore spreading those nationally. Next slide. So remember the 3 priority areas that Judy talked about for Million Hearts 2022. These, of course, are the priority areas we're looking for proposed innovations to address. And then, as she also said, I just want to reemphasize, while we traditionally think of healthcare organizations and health centers focusing on the optimizing care piece and the priority populations, we also want to encourage thinking beyond those traditional boundaries to propose ideas that also focus on keeping people healthy in a community setting. That said, innovation should be able to impact outcomes quickly. For example, while a community garden is always a good idea, think about trying to start one in February and have that show impact by June is not really realistic. So think about strategies that can be implemented relatively quickly to demonstrate results and that have the potential for broad impacts in these priority areas. You can see that we sort of doctored up this slide, added several icons around the Million Hearts graphic that are there to illustrate examples of the types of innovations that might fit into each priority area. So in the RFP that Rita is about to discuss in a minute, there's a link to examples or strategies for inspiration or confirmation that an idea is viable. That said, as a final note, I want to leave you with this. So remember that while both innovation and improvement are change, and both are trying to make something better, improvement is iterative and typically incremental. Is trying to improve something that already exists. Innovation really requires a different mental model. So it's creation of something fundamentally new and different from what we've experienced before. It's sort of flipping something on its head, approaching it from a new direction. So certainly we want you to build on things that we know work, but we want you to think about those things differently. So with that, I'm going to turn it over to Rita.
Great. Thank you so much, Meg. And looking forward to really diving into when you're submitting what you're looking for and how to make sure you're submitting a successful application. So on this slide, it goes over a bit of the detail of what we're looking for in each submission. Our goal is to make the submission process simple and easy for all the applicants. The submission link that is available on the NAC website as well as the RFP We'll ask basic organization details and point of contact information of the person who will be the lead or point of contact for the submission. You're only really required to attach one document, and that is the written narrative. Just keep in mind that the word limit is 1,000 words. You may also attach up to 4 supplemental documents, so you'll see the options for 2 web links or YouTube channel links, and also 2 additional documents such as materials or promotional brochures or other documents to upload. So you will have some options to upload additional materials. But in focusing on the written narrative, I want to make sure everyone is aware of all the detail that we'll be looking for and needs to be included in that document. Primarily, it's the innovation description and letting us know exactly what it is that you're bringing to the table and letting us know what that idea is. And also being able to identify at least one of those Million Hearts 2022 priorities and targets. If it meets more, that's great. Make sure to identify that. But just remember, we do need to see at least one of those targets are being addressed by the innovation. For the innovation, it can be in a variety of care settings. It can be at the health center, something that's addressed at the patient's home, in a community. So there are a variety of options of ways for the care setting to be that the innovation may actually impact. Other details that we'll need to make sure are in that description of the written narrative are the resources needed in terms of staffing, technology, devices, other tangible information that will be important to address as well. Additionally, we want to make understanding the timing of how quickly you can get it going and the difficulty or challenges or ease of implementation that come with that innovation. So we really want to understand the full gamut in detail of what it is that you're working to implement for your community, for those patients, and also how it impacts the staff going forward. And lastly, with that, any projected expected outcomes or impact that may be known about this particular innovation. When looking at the type of eligible organizations, we are focusing on the health center lookalikes, and the organizations that support them. So really targeting that HRSA definition of what a health center is and those lookalikes who function similarly but may not have that federal funding, and really the primary care associations that support them at their state level, and also the health center controlled networks that are part of the grouping and navigating the care and organization implementation for those particular health centers. So that is where the types of organizations who will be eligible for this particular innovation competition are. We want to make sure you guys have a good understanding of where you'll be scored based on the description of the items that I just previously went over in the last slide. As you'll see from here, there's an emphasis on really making sure it's targeting those Million Hearts goals and priorities. So as Judy mentioned, make sure to dive in and review the Million Hearts page. We also outline and go over each of the items and priorities and goals and priority populations in the RFP document. And we're happy to help with any questions you may have, and feel free to email me if you have any questions going into detail. We'll also be looking heavily at the design and how feasible this innovation is. As Meg mentioned earlier, we are going to be looking at, is this something that is feasible for other organizations to do, and understanding the type of needs that go into that. So we'll really be heavily looking at these first 2 categories. While these are scored heavily compared to the others, it's still important to make sure we have an understanding of the ability to implement and test it during the project period in 2021, as well as making sure there are sufficient staffing and resources and leadership support to really ensure that this innovation will be successful. And also in that narrative, making sure that we understand the budget and how much it will cost and what pieces of that budget will be going where. As Meg mentioned just in her section, we are budgeting up to $20,000 per winner, but if there's something you have that's great, don't feel discouraged. You have to fill a budget. We're looking at a wide range of things from simple to complex, but looking at how it's going to be beneficial in meeting those Million Hearts 2022 goals and priorities and target population. So hopefully this gives you an understanding of where the scoring is. While we will have this here in the slide deck that will be shared, this is also in the RFP document. So if you have any questions, please let us know or add them into the Q&A, and we'll be happy to address them during that time. To go over the timeline of what we'll be looking at and when things will happen, there are a few steps to getting to the final awardees for this competition. The first step is getting the application in and submitted by 11:59 p.m. Eastern Time on Tuesday, November 24th of this year. We'll also have our team of NAC and CDC experts who will be reviewing this first step, and we'll let you know who has made it to the next round. So the semifinalists who have been selected from this initial review. Those semifinalists, you're not quite done yet. The next stage will be an actual virtual pitch. So you'll be actually able to speak to a panel of experts and panel of reviewers who will hear more in detail, and you can actually speak to someone and do a little more personable pitch and a little bit of a Shark Tank-like presentation to let us know why your innovation is great and things that we should know about it and what you want us to understand. Those pitch presentations will happen in January, between January 11th through 19th of 2021. And from those, once we whittle it down from this first step down to the semifinalists, then we'll be choosing the finalists who will actually be awarded to implement the innovation based on their budget, what they've described to us. We do plan on having at least two, so that's why we emphasize that if you have a varying budget, that allows us to have different numbers of awardees, but we'll have at least two awardees for the finalist round. We are expecting that those finalist awardees will be able to implement and produce a final report during the project period of February through July of 2021. So want to make sure that you are able to be available for not only the virtual pitch session, but also someone from your team and your health center or your team to be able to implement during the project period. We know we've thrown a lot of information at everyone, and we're happy to answer your questions. So now we'll start our Q&A session, and I will, so for this Q&A session, actually, for attendees, if you would like to raise your hand and ask your question aloud, we're more than happy to do that, but also please feel free to put your questions in the chat or in the Q&A session, Q&A portion of this to make sure we're asking your questions. And I'll say, Haley, do we have any initial questions in the Q&A for us to answer?
See, there's one question about the eligibility. So is the $20,000 per PCA or per CHC that a PCA would work with?
So this would be per applicant. So if a health center is applying and maybe working, they would be through that applicant health center. They would be the awardee for that up to $20,000. Just to clarify, if I don't think we mentioned this, but want to make sure it's known, if a organization has more than one innovation that they want to submit, they can also do that due to separate applications for those. But for each application, the amount is up to $20,000. Are there any other questions that we have in the Q&A, Haley?
Not that I'm seeing at this time. Do you want to confirm that the link to the RFP is sent in the all attendees? So look there for the link.
Yes, I will get that and submit it shortly so that everyone has that link in the chat to access the RFP document.
And Rita, this is Liz. Folks, I'm just going to chime in just in case you missed housekeeping announcements. If you'd like to pose your question for us, again, Rita just gave us two different options. There is a little hand icon in the attendee section. It should be very close to your name. If you click that, that indicates, I'm going to pretend to raise my hand right now. It's going to let us know that you want your line to be unmuted, and we'll go ahead and unmute that so you can pose your questions. Alternatively, you can use the chat box. You may have to expand the panel, but most of you, it should be already open. Please simply just type your question into there and just make sure you hit the submit button. That's the only way for us to receive your question, and we'll go ahead and read that out loud. So again, two-sided, feel free to use the raise my hand by clicking that icon, and we'll indicate that we'll unmute your line. Alternatively, you can use the chat box, just type in your questions, and make sure you hit the submit or enter button on your keyboard so we get that, and we'll read your question out loud. I'm going to turn things back over to you, Rita.
Thank you. Okay.
I see another question in the chat. Is the budget for the amount requested or for the entire project? Are there any ineligible costs? Example, salary.
I see. I'm going to ask for a little bit of support from Meg and Judy just to make sure I don't give the wrong answer, but I believe that $20,000 would be inclusive of implementing the innovation. I'm not so certain on the staff salary component.
So hi, this is Meg. So the question is the budget amount for the requested, would you read the question again? I just want to make sure I'm answering the correct one.
Yep. Is the budget for the amount requested or for the entire project? Are there any ineligible costs? For example, salary.
Oh, no. Okay. So, and I'll have Judy back me on this one if I say something wrong, but no. So there aren't any ineligible costs that I would be aware of, as long as it's appropriate to the innovation. And it is for the entire project because it's meant to be a very quick turnaround. It's meant to be a pilot. So, Rita talked about how it's going to start in February. There needs to be some demonstrated results by June. So it's not a large scale project where we would be covering, hopefully not a huge amount. Judy, do you want to add more to that?
Yeah. I was just going to offer that, again, think about it as short term. What we're really looking for is those of you that have some projects already in mind, something that you may have thought about doing but didn't have the funding for, and thinking about this as some one-time funding. The salary, I don't think that would be an ineligible cost, but it might be an unexpected sort of cost. Please recognize these are one-time funds. So it is an amount of money for a period of time. That's it. And so the concept of what can you do in that short period of time where some resources would be helpful. I think if covering part of the salary is part of that, that would make some sense. But you would just need to know it's really short term and one time.
I see another question. Will the presentations be virtual or in person?
The presentations will be virtual, so we'll hold them over like a WebEx or type of Skype type of format, but they will all be virtual. They will not be held in person.
And it looks like there are a couple people with the question mark icon.
Yes. I see Patty Linduska. I'm going to unmute your line so you can ask your question.
Oh, did I hit my hand? Sorry.
That's okay. I can go to the next person in line. Okay, Christopher Wilkes, I will unmute your line if you have a question.
Hello, thank you. So my question was, the projects, do they have to be directly related to heart disease, or could the project be pertaining to a condition that could potentially lead to heart disease complications down the line if the condition is not managed?
So the primary focus are the ones that have conditions that directly relate to the Million Hearts goals. So we're looking at those that address on reducing heart attack and stroke. I think what would be an interesting component to add on is if it additionally impacts another condition, but our primary focus are those that are directly related to reducing heart attack and stroke as aligned with the Million Hearts 2022 priorities.
Okay, thank you very much.
And I'll just add on in case it wasn't clear. So we really are still looking to meet the goals of Million Hearts that will lead us to 1 million events prevented. And so that's the 20% reduction in sodium, tobacco use, and physical inactivity, and getting to 80% on aspirin, blood pressure, cholesterol, smoking cessation, engaging patients in healthy behavior. So there are clearly some things in like engaging patients in healthy behavior that also fit into hypertension control and cholesterol management as far as lifestyle that help with other diseases, but we're looking along those lines. I think if there was, when I'm thinking about hypertension control, the concept of making sure that one is screening for chronic kidney disease, might be a particular decreasing the concept of having a heart attack in somebody that has hypertension, that would definitely fit. I would encourage, as you're thinking about any of the ideas, to just play around with the Million Hearts website. You'll see some of the activities that and guidance that we've put out, as well as some of the strategies and links will give you a good idea of the kinds of things that we might be looking for. Again, we don't want to hamper that. We are looking for some innovation, but if you really anchor everything on will it have an impact on the keeping people healthier or the optimizing care goals that we have? Thanks.
Rita and Judy and all, there are some great questions that are in the Q&A that I answered by typing, but I think it might help everybody if I shared the questions and answers out loud. And then if there are follow-on questions, please feel free to ask them. So they're really good questions. The first is the innovative opportunity only open to 2 organizations in the nation with a cap of 20K? And my answer is the innovation opportunity is not limited to 2 organizations funded at 20K. It really depends on the quality of the applications received. Our lower limit is to fund at least 2, but we'd like to fund more than 2. And it really, we left ourselves some wiggle room in all transparency because we don't know if we get, 5 applications that are smaller budgets that are really exciting, then we might do that. I'm not going to tip my hand and tell you what our cap final budget is, but I will say that we definitely would love to fund more, and that's not, it's not a cap of 2 organizations at 20. Hopefully that somewhat answered your questions. Let me go down to another one that's related. Is the 20K per PCA or per health center that the PCA would work with? And I answered it this way. It's a $20,000 cap per organization that applies. If the PCA applies, the cap is still 20, but there is no limit to the number of applications an organization can submit. It doesn't mean that we limit. So the other question that's related to this is, can we have a health center apply and then a PCA apply to support them? So you could do that. It's an interesting question. The short answer is yes. However, we can't promise funding to all the linked organizations. We'll evaluate each application separately, and we are looking to fund a variety of organizations in a diverse sort of geographic spread. So I can't promise you that, but I can say that if there's a very compelling reason why we should fund both and you make that evident in your application, we'll consider that. Judy, do you want to add to that one?
Yeah, could you see me looking for my mute button, unmute button? I just wanted to add, one of the driving things behind making the funding decision, besides it being a really exciting opportunity, will be the feasibility. And so I would sort of question if you have an application and it's only if another applicant also gets funded, it won't come up high on the feasibility sort of thing. And so I would encourage the sort of putting it together if both parties are needed in order to be successful. I think that would be a smarter strategy. You clearly can do it however you'd like, all are eligible, but really know that in that first screening for ideas, we'll be looking for, is it in sync with what we're getting at the objectives that we're looking at for Million Hearts? And, is it something that you all are ready, geared up, ready to do, that resources are a piece that's missing, and if we were to give you those resources, you'd be able to execute?
Super. Thank you, Judy. And I'm going to ask and answer another, and you're probably going to want to chime in on this one too. Would an organization applying for 2 different projects in 2 applications be able to be funded for both? And again, the short answer is potentially yes, if both are interesting and show impact and are selected. But that's the caveat is that, we are interested in funding a variety of organizations across the country. So I think we will take that into consideration. If we have, all of our applications are in one state, we will look at that. Judy, do you want to add?
No, I would say that's absolutely right. And I think the strategy, we tried to make the first go-round as low lift as possible. I think it's a 1,000-word cap, et cetera. We would prefer to get more ideas and then be able to have them come forward in January for the sort of selecting the to be able to pitch it more further. So for me, I think one of the strategies or questions you might have is, are we doing ourselves a disservice if we put forward 2 ideas? I don't think you'd be doing yourself a disservice other than the amount of work that it takes, because one idea might just, appear more competitive than another. But the likelihood of us putting all of the funding in one geographic area or for one strategy is somewhat limited. But that's also why if you've got 2 good ideas and you have the bandwidth, I really would encourage you to submit 2 good ideas. They might be competing differently.
Thanks, Judy. I think that's it for Q&A. Let me just make sure there's not something else out here. Oh, there's one more. Okay, it says, can you confirm in the application we should choose one of the goals, i.e. reduce sodium intake by 20%, and then our idea to achieve it? Should our target reflect the Million Hearts target? Judy, do you want to take that one?
Yes, big picture, it should. I wouldn't expect you to meet that target in a short few month period, but that should be the goal that you're going towards is to get there.
All right, that looks like all we have in Q&A. Are there any more in the chat?
While you guys look through the chat, Amanda Giussino, I see you have your question mark raised, so I will unmute your line so you can ask your question.
That was another leaning on the keyboard moment, I guess.
Not a problem. We're all learning how to use the technology. Okay. I think we've covered everything in the Q&A. Are there any additional questions that may have come into the chat?
None that I'm seeing.
Okay. And we certainly don't have to take up everyone's entire hour. We, are happy to give you guys some time back, but we can also, hang around a little bit if anyone thinks of anything. But also please feel free to ask any questions and email of us after this webinar is over. I was able to add the direct link to the RFP PDF off the NAC website. So hopefully that works. Please let us know if it does not, and we'll be sure to try and get that to you directly. As we're closing up, we just want to thank everyone for taking time and their interest in this competition, and we certainly hope that we are able to hear all the great ideas that all of your organizations have and are hopefully implementing, and hopefully can be awardees and get some funding for doing so. You'll see here I created a few bit.ly links for easy access in these slides to share, but also to click on in the slides that will be shared after. So we'll have the RFP document link is here, and also the direct link for the submission form to submit the application. As a reminder, we will have the deadline of Tuesday, November 24th, 2020. Remember, 11:59 p.m. Eastern Time. That is right before Thanksgiving, in case you're thinking about your timing and getting that done before that holiday. And also want to make sure that we have any other questions. I'm seeing people. Okay, Judy has another question. Go ahead, Judy.
I saw one, and I have no idea where. I just saw it float up. But is there a cone of silence, or can people call to get more information or to talk about their ideas? I'll turn that over to Meg, because the the cone of silence or not silence would be the NACHC shop, I think.
So I'll take a stab at this one. I would say, this is Joyce Lawrence, I think, question. We would enjoy your questions that are administratively focused, but we're not going to give you hints or tips at what we're looking for in terms of content. Does that help? So you're welcome to reach out to clarify what we're asking for, or clarify, if you have any technical difficulties or other kinds of administrative things. Glad to entertain those. Does that help?
Yep. And I am adding my email address to the chat as well. It's in the RFP document as a point of contact, but I'm also adding it into the chat. Please feel free to email us. As Meg said, we're happy to give you guidance on, the administrative pieces of it and making sure you're able to submit okay and get all that information in. But we're really just trying to understand what ideas are out there. We know this year has made people pivot a lot, and hopefully from that we've gotten some great ideas on how to address heart attack and strokes and getting towards that goal of reducing 1 million heart attacks and strokes. So I think we've answered everything. So again, thank you everyone. I really appreciate your time. We'll be working with our communications team to get this recording and the slide deck sent out to attendees. Please feel free to share this widely across your contacts for those who think you may be eligible and interested. We're really excited to hear all the great ideas that everyone has to share, and hopefully see you in January for the semifinalist competition round. If there's nothing else from our CDC colleagues or NAC colleagues, I want to say thank you and have a great afternoon.